thanks again for joining us. Mike Milano, Nick McNamara, together we're M&M, and Dr. Ilya Skolnikoff. Thank you so very much for joining us.
What is the difference between what you do and what a traditional chiropractor does?
Not many people go to chiropractic school for 4 to 5 years and then become a chiropractor and spend 15 years studying all the things I've studied. So if you mean how many people are like that, not a lot of people. But are there people who are suffering like I was? Oh yeah, absolutely, for sure. And do they have trouble finding somebody who can help them? Absolutely, for sure. But I'll have my patients come in, they'll get well over 30 or 40 times the results in just one, not 15 or 3 or 10, not 2. One treatment visit, they're getting well over 30 times the results because we're able to address exactly what is the underlying causes of their health concerns. Everyone has a structural cause to their health concern because our body's made up of bones, ligaments, muscles, tendons, joints, stuff like that, right? Everyone has an emotional component to their health because we're emotional beings. Even the other mammals are also emotional beings, the cats and dogs, and all these other mammals. And then there's always going to be a chemical aspect to our health because of the way the world works. We breathe air, we drink water, we eat food, we use personal care products, we have our food grown in a certain kind of soil. There's problems with the ozone layer. There's radiation in the environment. Those things affect our health. And not many people know how to address them and deal with them. I mean, when I say not many people, I mean really not many people. I mean like almost nobody. Sure. Luckily, Dr. Viktor Frankl did. He's now passed away. He was the developer of total body modification, and he developed this entire technique. There's still a lot of the chiropractors that just do what they were taught in school. I went on and got a lot of extra education.
How many times have you had someone come to you with I've tried everything, in kind of like where they're just looking for answers. They've tried so much other verticals, and somehow they got put in touch with you?
I get that all the time. I mean, thank you for asking that. Really great question. So the other day, most of my patients are coming to me either because their friends or family referred them, or like you just said, they found out about me and then, they're really frustrated on the way in, right? So they have Hashimoto's or Graves' disease or autoimmune disease or a thyroid condition, or they have a hormone imbalance and they're like, hey, I've been to 12 different doctors to get help and nobody's been able to help me. I'm like, what are you going to do? What are you going to do? I'm going to be really polite. And just because I've done this before, the next thing I'm going to do is find out what's wrong and how the therapies we do can help. And if I can help you, great. We're going to go through this whole process and we'll do it completely differently than anyone you've ever been to has done it before, because you're looking for something that's different that gets results like the results that we have.
So where's your office at?
So we're at 4340 Redwood Highway. We're in between Margarita Plaza and the Vineyard. So on the other side of the freeway is the YMCA.
Yeah.
So that's where we're at. Mitchell Boulevard is on the corner. So
I really love that you take that approach. But what I really like is you have a new book out, right? I mean, you're putting this information out to the masses. Can you tell us about the book?
There's this book that I wrote. It's a new book. It's called The Skolnikoff Method, New Medicine for a New You. And what it really is a story of myself and my father's relationship. It is a healthcare book. It's a medical text that's easy to read for the layperson. So I am not the first person to write a medical text that's easy to read for the layperson. No way. I mean, there's been so many written that are great books. Wheat Belly and, The Sugar Blues and all these great books. Gut and Psychology Syndrome by Dr. Natasha Campbell McBride. That's not that easy to read. But anyway, the point is that I really want to talk to my reader who is not a healthcare provider or a medical professional. I don't mind medical professionals getting value from the book, but my father was a psychiatrist. I'm a chiropractor. One day I told my father, hey, I'm going to go to chiropractic school and I think I'm going to, become a chiropractor. I think that would be a great idea. And he says, well, can you actually make money doing that? I said, well, yeah, actually, Dad, some chiropractors make a lot more money than you do. He says, oh, well, that's good then. But the thing that he didn't say was, wow, you're threatening my ego. Because this guy's a psychiatrist, right?
Sure.
His thinking is old school. My thinking is new school. His thinking is the old medicine. He comes from that emergency medicine background, even though psychiatry was the big new development of his time, right? Freud was alive while he was alive. So it was the cutting edge new medicine.
Mm-hmm.
They were not accepted. Psychiatrists were not accepted because they didn't feel like everybody needed to have a surgery. They felt like some people could have talk therapy. And they got into the conventional medicine world that is accepted by the AMA and the entire conventional medicine establishment. In fact, it now, in some ways, it rules the medical establishment with all the psychotherapeutic, they're not therapeutic, but the antidepressants and the anxiety meds and all these psychotropic meds or whatever. But so I came from that world, and the book talks about that. And it goes into, what do you do if you have autoimmune disease? What do you do if you have a hormone imbalance? What do you do if you have a divorce coming up and you're not sure what to do with your life? That could be tricky. What do you do if you just lost your job? I mean, it's not going to give you every little answer, but it's going to take you to a path where maybe you can get the result you want. I just call it the path to health, but maybe more to it than that. What do you do if you have a hormone imbalance? And like you guys and I are talking about, you've already been to all these people to get help for the hot flashes and night sweats. Man, I haven't had anyone in my practice ever that I wasn't able to help with a headache, that I wasn't able to help with hot flashes and night sweats, period. So the only...
Ever. Huh? You've never, ever not been able to help those people?
No, there was a time before I started chiropractic, or before I became a licensed chiropractor, this little 18 or 19-year-old girl was coming in to see me in my clinic in chiropractic school. Can't remember her name. She was like a sugar addict, and she kept eating it, and she just wouldn't stop. And I said, you should probably cut back on your sugar. But I wasn't allowed to use all the therapies that I was already learning when I was in chiropractic school, because it wasn't approved of by the clinic there at the chiropractic school for me to get my hours and get my chiropractic degree. So they wouldn't let me help her. I'd try to kind of help her on the side a little bit. It helped a little bit, but no, I couldn't help her with her headaches because I wasn't allowed to. But once I graduated, yeah, if people come in for their visits and they keep their visits, there's this mystery out in the world that these health concerns are permanent and that healing is temporary. Hey, check it out.
Yeah.
If you have a really serious health concern, it's real for you and you're suffering. Right. And that's terrible. Mm-hmm. It's real. It's not like nobody's BSing you. You know that because you live with it every day. Right. Just as real as your health dilemma is, or your disease, or whatever it is, hormone imbalance, whatever, thyroid disease, so can be healing and your health. Mm-hmm. You can be healthy, and that can also be real. And it's a choice now. Maybe it wasn't before now, but now you have an option.
It's probably more expensive to get care that just kind of keeps you feeling a little bit better, as opposed to paying for something that moves you through what they're dealing with. Because it's not just a little more expensive. I mean, I'm not going to break it down on a calculator, although I'm thinking about that. Mm-hmm. So what happens is, let's say you see a psychiatrist, and your fee for the psychiatrist is, it's going to be $200 or more per visit. If you're seeing them once or twice a week, that's going to be, this is actually what they charge. Okay, there's not many psychiatrists that do that anymore. But even if you just have your insurance cover it, the copay is $20. You just add that up. If you're seeing the psychiatrist once a month for 12 months, and you do that for a number of years, that adds up to X amount of money. Then you go and see the nutritionist. The nutritionist charges $70 or $110, and you do that once every couple of weeks. You do that for a number of years. You add that up over the course of 7 or 8 years. You just add up each thing that I do, and then you're coming up with over 28 grand, right? Here's the thing that I definitely want to add. You can interrupt me anytime, by the way, I don't mind. So
I don't think I've like been asking all my patients who come into my office with autoimmune disease. I mean, patient after patient after patient for years now. And I just want to know from them. I ask them one thing. I say, well, you have an autoimmune disease. They all have some things in common. So what did your doctor tell you? Did they tell you what's causing your autoimmune disease? Because sure enough, we know science wise, forget about whatever you're hearing in the media. Forget about that BS. Okay, seriously, don't listen to that.
No, I don't listen.
We know that there's an underlying cause to every autoimmune disease, and they all have something in common. So you have one. Has anyone ever told you what it is? They say no, not really. They say maybe it's because my immune system's overactive. Okay, yeah, it is. Obviously, you have autoimmune disease. Well, they say maybe it's because I smoked when I was younger. Well, that's not healthy. That's definitely part of it. Yeah, poisons and toxins. They say it's because of it. You have a digestive disorder. Well, yeah, okay. Well, what is, I guess that's important too. That's important too.
Yeah. Yeah.
Yeah.
You have asthma. You change your diet and you get your digestion working right. Asthma, gone.
Mm-hmm.
You have rheumatoid arthritis. You change your diet. You get some therapies, or maybe you don't even get the therapies, but you just change your diet. Maybe see somebody who does a few emotional therapies. Rheumatoid arthritis, gone. You have Crohn's disease. Crohn's is gone. You have Crest syndrome. Crest syndrome's gone. You have the juvenile rheumatoid arthritis, also juvenile arthritis this month, July. That's the month nationally. So you change your diet for that little kid who also can get arthritis that not many people know about, which is why it's an awareness month. Well, the little kid's better. You don't have to go to all these different healthcare providers. You don't have to go to, this, endocrinologist, that endocrinologist, this person, that person. You just got to know how to change your diet. You got to know what to eat. You got to know what to eat, how often to eat it, what not to eat. If you're allergic to something, you damn well better find out what it is, because you're not going to get better if you don't,
Right.
And so nobody's being told this. And so I've had patients get better who have these conditions.
Exactly. We're all connected, and I think a big important component to that is not keeping the great people a secret, and that's kind of what's driven us to do these interviews and to promote people that are really gifts to the community and shouldn't be kept secret, because you could probably help tons of people that have that feeling that's probably all too familiar and what you've heard over and over again, that they've tried everything, and this is just the way things are going to be for the rest of their lives, and it doesn't need to be that way.
Yeah, we have. I mean, it's interesting. It's interesting. I offer a lot of people a way to change around their health. Some people, they have, they're really having a trouble with finances and their credit's really bad. Maybe they're in the food industry or something, and they're just waiting tables isn't so bad. You can make pretty good money with tips. But if you're doing catering, that can be a little tricky and seasonal. Mm-hmm. But other than that, I mean, we have like interest-free financing. You just pay $20 or $30 a month to get started. I don't know, but I think it's a shame there's not more people like me, like you said, and more people like you, because it's hard to find a good real estate agent and it's hard to find a good doctor. And so thank you guys for doing this. This is awesome that you put this site together. I saw that site and I'm like, wow, this is like, I want to be on that site. Everybody needs to be on that site, huh?
I thank you for saying that. I mean, we're really proud of it. I think that we're working on getting it just out as much as possible. It's still,
we're creating a program called the Inner Circle. So everybody that we've connected they're just fantastic, like-minded business owners. But there's a lot of cross referrals that can happen within this. And it's just really nice to see that within our community of Nevada, within our community of Marin, and the little towns, like we have a really like special caliber of people that kind of ties us all together. You're one of them. I mean, Mike and I were raised here, so we kind of know that. We're just kind of getting that out. But you're part of our inner circle now, and we hope that we get to build our relationship. So we look forward to reaching out to you in the future, just seeing how you're doing and how we can help you and how our referral business is helping each other.
Cool. We're all family.
We're all family.
Mike Milano, Nick McNaboe, together we're M&M, and Dr. Ilya Skolnikoff. Thank you so very much for joining us.
Talk to you soon. Take care.
Take care.